Welcome back inside the Now Morning Show. I hope you got your tea and your coffee and you're ready this morning. We're going to have some fun conversations and some interesting learning things happening, especially for students. So this morning I want to chat with the coordinator of the National Alcohol and Drug Abuse Prevention Program under the Ministry of Health, Ms. Lyra Thompson-Hollingsworth. Good morning to you, Lyra.
Hi, good morning, Ruckus. Thank you for having me.
Thank you so much for joining us this morning. Tell me about the fantastic work that you guys have been doing at NADAP.
So NADAP is the lead agency responsible for drug demand reduction in Trinidad and Tobago. And among the vulnerable cohorts with respect to substance use would be children. And over the years, research consistently shows that children begin their experience with drugs or alcohol from a very young age, sometimes as early as 7 or 8. So a few years ago, we started having some sensitization workshops with preschool teachers and managers to talk about the issue of substance use in the home and children's exposure to it. Mm-hmm. And coming out of those workshops, the teachers and managers, they decided or realized that we don't have materials that are appropriate to teach children of that age about drugs. So we started a series of consultations and focus groups, and we developed something, and years later, here we are with a full-blown program. We've trained preschool teachers and managers and administrators across all educational districts, and also first year and second year teachers in primary school system. And thank you for TTT for showing those videos. It started a couple of weeks ago. So the Trinity Smart videos are currently being aired on TTT during the afternoon period. And it's something that we're very proud of.
Well, I think this is a very great initiative because I remember when I was younger, we used to watch, I think it was AVM back then though, and TTT, and there were these videos that would encourage you to, stay away from drugs and to do the right things and to make the good choices and all that stuff. So I'm glad that we're updating it because I know that, children's attention span very, very short these days. Tell me something, what is the youngest age that you guys discovered children being able to or children experimenting with drugs for the first time? What was the youngest that you heard of?
The age on average would have been, I mean, when research is done, they give you an average age, which is about 7. But when you work in the field and you go out and children are interacting, particularly like in rural areas and so on, where the exposure within a family would be really acute. Sometimes as young as 5, a child will know exactly what marijuana looks like and how to process it and so on. Because, I mean, these things happen within a family context, so children are not necessarily protected. But outside of that, we live in a culture that exposes children to alcohol very early because sometimes we give it to them because it's good for the worms, or around Christmas time, they're in a celebration context with family members visiting and drinking happening and so on. They might even steal a glass from a parent just to smell or to taste what, out of curiosity, so it can happen from very young.
But people, we have a culture here in Trinidad, like you said, we might give you a little taste, or it might help with the sleep, it might help with the worms and that kind of stuff. Tell me about the dangers involved in doing that. I mean, if culturally we can say that, well, my parents did it, your parents did it, everybody kind of just did it, and we all turned out okay.
Yeah, there are some dangers in there. When it comes to children and adolescents and even young adulthood, our brains continue to develop up until the age of 25. So that staying away, or rather introducing a substance like alcohol or any other kind of drug, can impact upon brain development and can impact upon how we carry out our activities up until that age. So for example, while at school, if you tend to introduce alcohol consumption while at school, it may eventually cause a child, and I'm saying may because it doesn't have to happen, but you run the risk of it happening, where a child may develop a substance use disorder later on. And that is what the research shows, that the earlier you start using a substance, the more likely it might be that you may develop a substance use disorder. And by substance use disorder, I mean that you may become addicted to a substance or likely to try something else that is stronger, because you're really interfering with the chemical balance of the brain and the brain's ability to develop normally.
And you said it
And
doesn't
that's
stop.
the
Yeah, you say we don't stop developing until 25.
yeah.
So then
So
our alcohol limit should raise the legal age.
well, that's another discussion. But really and truly, it really becomes a case where families protect their young people, you know, and even when you attain that age of 18, you still have to, you know, be careful and introduce things that are very gentle. You know, sometimes we've had experience where we work before COVID, where we work at Carnival Fets doing something called a sober zone. It was a program we piloted and it was very successful. And in the context of a Carnival Fete, you're talking about harm reduction. So it's in a space where people are drinking, but you want to teach people how to drink without having the harm associated with alcohol consumption, what we call heavy episodic drinking. So, and our experience is that a lot of times the older persons or the feds that are targeted to the older age cohorts, they know how to balance out their drinking. You know, sometimes you take a drink, then you have something that's non-alcoholic, you eat while you're drinking, and so on. The younger type fets, where it's cooler fets and people are coming mixed with all sorts of things in their coolers, and the person on stage is saying whose cooler is empty and so on, and they're drinking consistently. You find that they're the ones who are not exactly sure what's happening and how to get it done properly. So I mean, so the ages between that 18 to 25 is a very sensitive time where we have to say, wait, okay, hold on. Yes, it's the legal age, but this is exactly how it's done. And you don't necessarily have to drink till you're in a drunken stupor in order to have fun. You know, so there's the harm reduction side of it for that age cohort. But when it comes to Trinity Smart and educating children, and they in turn in educating their parents, that's the time where they have to be involved in other things: fun, learning, sports, the arts, painting, singing, dancing, and not necessarily taking one for the birds.
Yeah, definitely not. I agree with you 100% there. You know, it's always very interesting because I think that a part of that argument could just be that age brings wisdom, and these experiences that you would have gone through as a younger person between 18 and 25 getting stupidly drunk. Some people learn very, very valuable lessons in those moments. I often hear the same music that you referred to. You know, they talk about your friends that are with you and the cooler and all those sorts of things that people allude to. And I think along the way you also realize who your friends are and they aren't based on those same experiences. So I have mixed feelings about it. You know, I feel like it's a necessary part of the journey of life.
Well, I mean, we could agree to disagree on that, but because there are other risks as well,
Of
you know.
course.
And I remember being at a booth and we had a slide on the presentation that says being drunk is not fun. And that was a topic for discussion because a lot of people think that part of the fun is being drunk, and it isn't. You know, you see people and you get a chance to observe in an organic kind of way in the environment. And I remember being at a particular cooler fete, and a very, very popular soca artist was on stage. And there's this guy with his girlfriend in the fire services booth. She is passed out. She's coming in and out of consciousness and vomiting and so on. And he is there wishing that he was not there in the booth with her, but really in the fete having fun. And his expression on his face was one of, geez, why do I have to be here? Why does this have to happen? And you don't get to really enjoy, if you're really in a drunken stupor, the people around, you don't get to enjoy the fun. Sometimes, especially if you're a female or even a male, you can be in a vulnerable state.
Yep.
Being drunk, you know, you could be vulnerable to a sexual assault, you could be vulnerable to a robbery, or anything like that, or getting into a fight that you're not sure how it happened. So there's so many other dangers apart from the fact that you could be rushed to the hospital with alcohol poisoning. And I've seen it happen in a vet setting where the fire services is carting off somebody in the ambulance very quickly because their stomach has to be pumped from alcohol poisoning. So,
Yeah.
yeah.
I
So,
definitely
yes,
agree. I definitely agree that any excess, the excess is where we have the problem. So, like you said earlier, in terms of balancing how you drink at these events, if you are to go out and have alcohol, is about making sure that you do it within a particular quantity, you would say, or just
well,
be mindful of how.
there's a scientific quantity. Your body
Oh,
takes about 2 hours to metabolize one drink. So you really ought not to be having more than one standard drink in a 2 hour period.
Lyra, what is a
Now, I've
standard drink?
had one beer, or the bartenders will be able to tell you exactly how many ounces of liquor to chaser. Um, and I know carnival time that becomes very much up in the air, but but I've had the experience of actually attending a fete, not working at one, and from being at the fete maybe for about a 5-6 hour period, it would have been an all inclusive, so alcohol is readily available. I would not have had a drink without having something to eat. And whenever the meal and the drink was finished, I had a non-alcoholic beverage, maybe a cranberry juice or some water or whatever, and ensured that while an artist was on stage, that I danced and danced and danced. And so in one maybe 6 hour period, I may have had 3 or maybe 4 alcoholic beverages. And by the time I was ready to leave, I was breathalyzed at the gate and my reading was 0. So I share that story very often to let people know that yes, there are vulnerable groups who should never touch alcohol. If you have a substance use disorder, or if you have problems with alcoholism in your family, if you are underage, if you are driving, if you are the designated driver, in those cases, you ought not to drink. In most other cases, regular persons who do not have a substance use disorder can, and you're an adult, you can enjoy an alcoholic beverage within a scientific type of context, so to speak, and enjoy whatever event it is and be safe at the end of it. So,
Certainly.
and I was able to, yeah, I was
And
able to have a
we have
0
time.
reading.
We have time to be able to practice because we have no real event kind of happening now, so we have time to practice before we go back out for those kind of things. But Lyra,
Yeah,
before we
but
go,
we
can you
do.
tell me where,
Mhm.
if people want to see the videos, the animated series that you guys have started, is there
Sure.
anywhere available we can see it on demand?
Yes. On the Ministry of Health's YouTube page, as well as the Facebook page and their other social media pages, they're showing them one probably per week, loading them up. But I know on the
Okay.
YouTube page for sure it is
Okay.
available. There are 5 videos. So there's an introductory video. It's all animated, it's very child friendly, and even for adults, it has very good information in it. So there are 5 videos. The first one is an introductory video.
Mm-hmm.
The second one deals with alcohol and energy drinks. The third one deals with cigarettes. The fourth one deals with marijuana. And the last one deals with over-the-counter drugs, because unfortunately, um, we have something called lean and children are into mixing cough syrup and Sprite and things like that. And those
I've
things
heard of
can
it.
be, yeah, and it's very dangerous actually. It
It
sounds as if
is.
it's not harmful, but it is,
It is.
so
All
so
right.
yeah, so
Well, Lyra, I want to thank you so much for joining us this morning and for having this chat. It's always nice for us to be able to realize the science behind whether or not something we take for granted, like drinking, because our culture is very much filled with alcohol. But thank you very much for joining us.
I appreciate it. Thank you so much for having me.
No problem. Take care. Enjoy your day.